Understanding tonsillitis. Causes, symptoms, and treatment options. In this lesson we will learn more about tonsillitis. What is tonsillitis? Why is it important to understand tonsillitis? We'll dive into the causes of tonsillitis, its symptoms and diagnosis methods. We will explore treatment options and provide some tips on prevention. By the end of this video, you'll be better equipped to handle this common yet often pesky health issue. Let's start by understanding what tonsillitis is. Tonsillitis refers to the painful inflammation of the tonsils, the two oval-shaped tissues located at the back of your throat. Although the tonsils are part of your immune system, acting as the first line of your defense against bacteria and viruses, they themselves can become infected or inflamed, resulting in the painful condition we know as tonsillitis. This condition is not limited to children, adults too can suffer from tonsillitis, with its impact sometimes making even simple tasks like swallowing a very painful ordeal. The main differences between normal tonsils versus inflamed tonsils are related to their appearance, size, and associated symptoms. Normal, healthy tonsils are generally pink in color, matching the surrounding tissue of the throat. They are smooth in texture, though small natural indentations or crypts may be visible on their surface. Their size is proportionate to the throat, without any noticeable swelling or enlargement, and they do not obstruct the airway. On the other hand, inflamed tonsils are characterized by redness, swelling, and enlargement that may partially block the throat. They often have visible white or yellow patches, pus, or coatings. The surface appears rough or irritated, with prominent crypts sometimes filled with debris. Surrounding tissues may also appear red and swollen. Why is it important to understand tonsillitis? Understanding tonsillitis' key early symptoms and taking the appropriate steps to manage the conditions effectively as early as possible is important. Being aware of the causes, whether viral or bacterial, helps you make informed decisions about treatment, particularly in distinguishing whether medical attention is needed. Early recognition helps manage symptoms effectively. Being aware of the causes, whether viral or bacterial, helps you make informed decisions about treatment, particularly in distinguishing whether medical attention is needed. Taking immediate steps helps prevent complications such as abscesses and rheumatic fever. What are the causes of tonsillitis? Tonsillitis occurs when the tonsils become inflamed. This inflammation can arise either because of a viral or bacterial infection. Most cases of tonsillitis are caused by viral infections, particularly those that also cause the common cold or flu. These viruses include rhinovirus, adenovirus, and in some cases, the Epstein-Barr virus, which is responsible for infectious mononucleosis, glandular fever. Bacterial infections, on the other hand, are caused by the bacterium Streptococcus pyogenes, also known as the cause of strep throat, the most common bacterial culprit behind tonsillitis. Although rare, if left untreated, bacterial infections can lead to complications such as peritonsillar abscess, kidney inflammation, or even rheumatic fever. Other contributing factors that causes tonsillitis include allergens and environmental irritants, such as exposure to smoke and pollution. These irritants can aggravate the tonsils, making them more susceptible to infections. When it comes to treating tonsillitis, early recognition is crucial to ensure timely and appropriate care. The earliest and most common sign of tonsillitis is a sore, scratchy throat that doesn't go away. This discomfort might start as a mild irritation but can escalate, making it hard to eat, drink, or even speak. In bacterial cases, you might notice white or yellow patches on the surface, which is a hallmark of Streptococcus infections. Difficulty swallowing. This can lead to dehydration or skipping meals, which further weakens your immune system. If drinking water becomes painful, it is a sign to seek medical attention sooner rather than later. Other symptoms of tonsillitis to be aware of. A fever of 38 degrees Celsius or higher is the body's way of signaling an infection. Swollen lymph nodes, swollen glands in the neck are a physical sign your body is fighting back. Earache and headache. Coughing and feeling sick. Changes in voice. Bad breath is often a result of bacterial buildup, adding to the discomfort. Stomachaches and neck pain. While most cases are straightforward to diagnose, there are some situations where additional tests might be required to confirm the nature of the infection. Diagnosing tonsillitis typically involves a combination of a physical examination, patient history, and diagnostic tests to determine the cause of the infection. Here are the common methods. Physical examination, throat culture and rapid tests. Imaging tests if necessary. Physical examination involves doctors examining the throat and checking for visible signs such as redness, swelling, and fever. Throat culture and rapid tests. In some cases where bacterial tonsillitis is suspected, a throat swab may be performed. Rapid antigen test detects antigens, substances that trigger an immune response from group A Streptococcus. In rare and severe cases, when complication like peritonsillar abscesses or deep tissue infections are suspected, doctors may order imaging tests to get a clearer picture. These are generally reserved for recurrent or unusually severe cases of tonsillitis. Once diagnosed, the treatment for tonsillitis depends on its underlying cause, whether viral or bacterial, as well as the severity of the symptoms. Proper management not only aids in a faster recovery but also helps reduce the risk of complications. Treatment for viral tonsillitis focuses on relieving symptoms as it typically resolves within 7 to 10 days. Rest and hydration are essential, along with over-the-counter pain relievers like acetaminophen or ibuprofen to reduce fever and throat pain. Warm saltwater gargles, throat lozenges, and humidifiers can soothe discomfort, while soft, soothing foods and warm teas with honey help ease swallowing. Treatment for bacterial tonsillitis primarily involves antibiotics. It's important to complete the full course of antibiotics to prevent complications, and in severe cases, further medical intervention may be necessary. In some rare cases, if tonsillitis becomes a recurrent issue, your doctor might discuss the option of a tonsillectomy. Here are your key prevention strategies against tonsillitis. Since tonsillitis can often be caused of viral or bacterial infections, adopting good hygiene habits is one of the best ways to reduce your risk. Simple measures like frequent hand washing and covering your mouth when coughing or sneezing can make a big difference. Stay updated on vaccinations. Vaccines, such as the flu shot, can help you protect from specific viruses that may lead to tonsillitis. Avoid exposure to irritants like smoke. Boost immune health. Exercise regularly and get enough sleep to strengthen the immune system. By practicing these habits, you can lower the risk of both viral and bacterial tonsillitis. While tonsillitis caused by a viral infection often resolves on its own with rest, hydration, and over-the-counter remedies, there are times when seeking medical advice is crucial. If you experience symptoms like fever, extreme difficulty swallowing, or symptoms lasting more than a few days, a doctor's visit can help rule out bacterial infections, such as strep throat, which may require antibiotics. Prompt treatment in such cases can prevent potential complications like abscesses or rheumatic fever. And most importantly, always complete prescribed treatments. Following the doctor's instructions ensures effective recovery and reduces the risk of further health issues. Being informed about tonsillitis allows you to make better decisions for yourself and your loved ones. Always remember that tonsillitis is manageable with early recognition. While many cases can be managed at home, professional advice ensures the right treatment. Take charge of your health with informed decisions. Receive the appropriate diagnoses and treatment by consulting with your ENT doctor. By taking proactive steps and seeking timely care, you can effectively address tonsillitis and reduce the risk of future episodes. Thank you for watching, and see you on the next video.